Capacity building strengthens the ability of local healthcare systems and providers to effectively meet the health needs of rural populations. Rural areas often face unique challenges, such as geographic isolation, limited resources, and a shortage of trained healthcare professionals. By focusing on capacity building, rural philanthropies work to mitigate these challenges.
To really make an impact, we need to be able to convene partners to have tough conversations. We need to be able to help them access the resources needed to make a difference. We need to help make sure they're equipped to be better storytellers and to advocate for systems and policy change that will benefit them. We need to provide them the resources to help them test innovative models. We've also helped groups pilot innovative new home visiting models so that they can help improve early childhood development in their communities. And then we took it a step further in using the evaluation results to help change policies to make sure there's reimbursement for those services. Likewise, we recognize that workforce is a huge challenge in rural communities, and we see solutions coming from the communities. Provider types like community health workers can make a huge difference. So we help provide grant funds to build their capacity to employ community health workers, took those lessons learned to find a way to get Medicaid reimbursement for CHWs. We've done the same things with doulas, and I think there's a lot more opportunity. So the question for us is, how can we build capacity, use those lessons learned to change policies and systems?
The Black Belt Community Foundation, which is located in historic Selma, Alabama, and we serve 12 of the poorest counties in Alabama, and many of them rank among the poorest in our nation. One of the things that I do as a community engagement officer, I work with our grassroots leaders, which we refer to as community associates, and they are the heart and soul of our foundation. We value the voice of the community, and we work to build the capacity of individuals, government leaders, as well as the leaders of nonprofits that are attacking health disease or any other need that's in our community.
We look to support organizations that know what the community needs, and we look to help that organization both address that need and also to increase its capacity for the longer term in terms of thinking about sustainability. We also work with partners that engage in longer term partnerships with organizations to ensure that after the funding period is done, the organization has things that it is built into its infrastructure to continue to facilitate that access long after the project period is done.
The foundation has spent about $8 million to launch multi-sector initiatives to strengthen our communities so that they can take advantage of those federal and state dollars that come down. You know, in small rural communities, the person that's there writing the grant may be one person only. They may have to leave at 3 o'clock to go drive a school bus. They may also be on the water board. They may be on the school board. They've got multiple responsibilities in their small rural community, whereas urban areas will have entire teams to go after these federal dollars. And so what we set forth to do at the foundation was to try to bolster our rural communities so that they can take advantage of the federal dollars that are coming down and be more successful.
One of the things that EHF has found is that often when we have often had cohort funding opportunities where we will invite a community to gather partners, apply for a long-term 5-year grant with significant technical assistance and consulting input that allows them to build over time, learn from other communities what they're doing, and really follow a model. We allow organizations to follow models loosely based on what their community resources are and what the distinct needs of each community is.
The Palatine Foundation, part of our mission is working with very small organizations throughout our region. And so we see capacity building really broadly. We work with new and emerging organizations to help them build their basic infrastructure, like setting up their bookkeeping systems and engaging in board governance and strategic planning activities. And then for organizations that may be interested in applying for state or federal funding, we are able to support them with strategic or business planning, with getting studies or reports completed that would make them eligible to apply for that funding. We also work to connect organizations across our region that might be doing similar work or be able to put together a collaborative project that would be competitive and a strong applicant for federal funding. And we see that ability to know our communities and connect partners with each other and with other funders as a key piece of our capacity building work.